So, good afternoon, everyone. Good afternoon. वैसे आफ्टरनून तो यहाँ पे है नहीं. Hello, everyone. Am I audible or visible to everyone? Yes. Okay. So we can start the forensic recall. Yes. Forensic recall for FMG 12 January. So I'm coming one by one to every question. These are the questions which are recall based. Okay. So anyone, how many questions were there from like forensic medicine? Anyone who can give me the idea? How many questions? Can you tell me? The number of questions from forensic medicine. Anyone? So starting with question number 1. So actually the main topic was from forensic medicine, the very important topic was court of law. There were 5 questions from court procedure and law. Okay. So I'm starting with question number 1. So the first question was about the within a 3-year of marriage, the woman died. That is a dowry death, or it is presumed to be a case of dowry death. And father filed a report to the police and inquiry will be done under. So this was a question of the magistrate inquest. This was the question of magistrate inquest. Yes. And the question given was, which law is related with magistrate inquest? Which important law is related with magistrate inquest? Just tell me. What was the answer here? I'm not able to see the chat. Wait. What was the answer of this? Not able to see the chat. Wait. Hello. Live chat is okay. So it was a magistrate inquest. The answer is, as Ritesh Singhal has told you, it's very simple. That was police Martiya Choka and magistrate Martha Chakka. This was given in my notes. Very simple. So police inquest was 194 BNSS and magistrate inquest was 196 BNSS. Actually, the female died within 3 years of the marriage. That is a magistrate inquest. So that new law is 196 BNSS and the yes, police Martiya Choka and magistrate Martha Chakka. So this was a magistrate inquest, 196 BNSS and 176 yes CRPC. So this the answer is B, and this is given in my notes. The police inquest and magistrate inquest very beautifully. Okay, so magistrate conduct inquest in 6 cases A, B, C, D, E: mental asylum death, police beating death, police custody death, dowry death, exhumation, and police firing. Police firing. Very good, sir. And all police related death, it is a judicial magistrate. All police related death, it will be a judicial magistrate. Okay. So this was the question number 1. Same question, if the same kind of question came in the death of female within 3 years of the marriage, the inquest will be conducted by. Was that the question there? The female died within 3 years of the marriage, it will be conducted by magistrate inquest. So that answer will be magistrate. Okay. Now, yes, very good. The death in the police custody, was this the question there? The death in the police custody inquest will be conducted under? Yes. the death in police custody, the inquest will be conducted under. Thus, yes, without any doubt, the police custody death, the inquest will be conducted by judicial magistrate. Here answer is judicial magistrate. So 3 question or 2 or 3 question was related with this particular slide only. है ना? So police inquest is 194 BNSS and magistrate inquest is 196 BNSS. What was the trick? Police मारती है चौका और magistrate मारता है छक्का. So that was a very simple question. Yes. Now a forensic expert received summon from district court to record the evidence in criminal case 2 days back. Means he got, okay, the food reverie is saying that was not a question. This was not a question. The death in the police custody, that was not a question. Okay. Okay. But anyways, the magistrate inquest has 2 questions. What was the law for magistrate inquest? 196 BNSS. And in under what circumstances magistrate inquest is conducted? The death within 3 years of the marriage or for a female, dowry death? Yes. Okay, no issue. But the police custody reported this was not a question. So I'm making it cross for you. But it was not there. It was not there. But inquest here, it will be conducted by judicial magistrate. Yes. It was a suspicion whether this question was there or not. मेरे को बता रहे थे, कुछ बच्चे कह रहे थे it was a question, but many were saying no, it was not there. But anyways, now was this the question? ये देखना बेटा, ध्यान से देखना. आपको एक समन रिसीव हुआ है. In criminal case, you got a summon, and he already received a summon from civil case in the district court for the same day. मतलब you got 2 summon, one from criminal, another from civil case for the same date. Yes. That is okay. Death of a wife after 5 days of the marriage, that is also magistrate inquest. No issue. No issue. Now, under these circumstances, I am coming to this very important. This is my notes in PrepLadder. You can see in civil and criminal case, first you have to follow criminal. First you have to follow criminal. है ना? अगर आपको you got a civil case summon and you got the criminal case summon, you have to follow the criminal case. So in this case, without any doubt, attend the criminal court first as a case. Attend court of the criminal case. ये मैंने बहुत अच्छी तरीके से पढ़ाया था आपको. Civil, criminal, criminal. Okay, civil, criminal, criminal. You have to attend criminal case. Now, if both are criminal, you have to attend the higher one. If both court are criminal, you have to attend the higher one. If both belong to same level, then you have to attend the first received summon. Then you have to attend the first received summon. Yes, very good. Civil criminal में criminal attend करना. If both are criminal, then you have to attend the higher court. And if both belong to the same level, you have to attend the first received summon. There was option to inform the court. No. First you have to attend the court, civil and criminal. Then you have to attend the criminal case. Okay. Yes. Inform the both court and wait. No. This was not the right answer. This was not the right answer. Inform the. No, one is criminal. Dr. Migraine. One is criminal, another is civil. You have to attend the court for criminal case. Okay. You need not to inform both the court and wait. No. I told you civil and criminal, you have to attend the criminal case. Okay. He's saying that both from criminal case, then you have both from the civil case, then you have to see which is higher. Then you have to see which is higher. Okay, Dr. Migraine, you got my point? अगर दोनों civil case से होते, okay, done. चलो. Now, leading question can be asked in which examination? Give me the answer. Tell me. Leading questions can be asked in which examination? Very simple question. This was also told in the many classes. Leading question are permitted in which examination? Yes, without any doubt. It is cross-examination. You can see many questions from the court procedure only. Yes, you can see this is the slide which I covered. Leading question are permitted in cross-examination. Yes. Leading question are permitted in cross-examination. This is the slide which I told you very briefly, but very important slide this is. Yes. Leading question are permitted in cross-examination. सबके हो गया? So again, I am coming to these question. Leading question can be asked in cross-examination. And if you have summoned from 2 court, civil and criminal, you have to attend the criminal. Yes. Done. Okay, very good. One was from the expert witness. Death in the police custody, you are saying it was not a question. Death within 3 years of the marriage or 5 days of the marriage, it will be magistrate inquest. Okay. And this was the question. That was magistrate inquest comes under which BNSS? I told you the trick. Police मारती है चौका और magistrate मारता है छक्का. So that would be 196 BNSS and 176 CRPC. Whatever question, both options were there. Okay. Now, a Villager was assaulted by 4 to 5 people, brought to the hospital in serious condition, and his dying declaration was being taken. His dying declaration was being taken. What is correct regarding the process? Can you tell me? Only police can record the dying declaration. This is the wrong answer. Yes. Can be recorded without oath. Oath not to be taken. Yes, can be recorded without oath. This is the right answer. Leading question can be asked. No, leading question are not permitted. Oath is compulsory. It is not compulsory between dying declaration. Okay. The Pavina Evangeli is saying that, sir, both were district court. I am telling you that both were district court. Doesn't matter. Civil, criminal, if both words are given, you have to pick criminal. Civil and criminal both are given, you have to pick word criminal. If both are civil, then see the which is higher. And if both are same level, just see which has been received first. Okay. So this was the right answer. B, can be recorded without oath, oath not to be taken. This was the slide which I covered. This is all about dying declaration and dying deposition. As I told you, oath is not taken, cross examination not done, and leading question are not asked in dying declaration. Yes, Rahul R is saying no, it was criminal and district. So Rahul is absolutely right, and the many students are telling it was criminal and district civil. So you have to pick the criminal one. Okay, is it clear, beta? यहाँ तक clear हो गया दोस्तों? And one thing I am telling you, 99% of the forensic medicine question from directly from the notes, है ना? तो आपको forensic medicine में अगर आपने कोई गलती की, you committed mistake in the forensic medicine, that means you committed a crime. What was the level of paper? Easy to moderate, moderate to tough, or it was tougher? Tell me. What was the level of the paper? Easy to moderate, moderate to tough, or it was very tough? Tell me. Anyone? Moderate. Sharad Chaudhary is saying that it was moderate. Okay, chalo koi baat nahi. Very good. Easy to moderate. Rohit is saying. Very good. But forensic according to me was easy to moderate. Forensic according to me it was easy to moderate. A person got stabbed on the anterior thigh and died. His body was found, brought for the postmortem. What was that type of injury? Yes. So the person got stabbed in anterior thigh and died. Definitely it will be a penetrating injury, because penetrating injury is injury to the vital part because it goes in your cavity. It goes in your cavity. So as you can see, yes, my dear friend, the puncture is on the tissue or skin. Yes. Penetrating, which goes in the cavity like liver, there will be perforating. What is perforating? That is, perforating is through and through. There will be entry, there will be exit. So puncture on the skin or tissue, yes. Penetrating was in cavity, and perforating, there will be entry and exit wound. So without any doubt, the answer, because it is affecting you died, that will be, yes, the size was given 3 into 5 into 1. Definitely it will be a penetrating wound. Ashens age is saying the size was given. Beta, very good. आपने size बताया, I will make it mark, but it is penetrating wound. चलो next पे चलते हैं. Sir, a person fell down and got injured, present with a brownish scab. Definitely it was asked about the abrasion. What is the estimated time of injury? Anyone? There was a brownish scab. There was a brownish scab. What was the estimated time of the injury? And actually, if you see this table, I told you for this abrasion. The table I told you this for abrasion. Bright red, 12 to 24 hours. No, sir. The question is, you got someone from the 2 district court. In one court, you are the expert witness, and one was your mistake. For your mistake. Okay. Anyways, again, I am telling you, if the one is civil and criminal, you will pick the criminal. If both are criminal or civil, you just pick the higher. And if both belongs to same level, you just pick the summon which has been received first. No issue. Now tell me, bright red scab, 12 to 24 hours, reddish brown, 2 to 3 days, brownish scab in 4 to 5 days, and black scab, it is 6 to 7 days. So without any doubt, what will be the answer here? Tell me. Okay, no issue. Now tell me, what will be the answer of the brownish scab? चलो उसको छोड़ो बेटा, मैंने आपको concept बता दिया. These are the recall based question, because we are getting the question from you people only. Tell me, it is 4 to 5 days. Very good. It is 4 to 5 days. Very good. Done. Sir, the body came for the autopsy, was cold and have developed rigor mortis in all the limbs. It means the rigor mortis developed in all over the body or all the limbs. The liver mortis at the back and fixed, but no sign of putrefaction. Yes, wait. But no sign of putrefaction. What will be the estimated time since death? So rigor mortis develop all over the limbs, means all over the muscles, and liver mortis at the back, which is fixed. As I told you, yes. Postmortem staining, that's the liver mortis, begins in 30 minutes, visible in 2 hours, maximum in 6 to 12 hours. Okay. Fixation in 7 to 8 hours. Fixation, okay, no problem. अगर 12 to 24 hours होता तो भी कोई issue नहीं. Fixation of the liver mortis is in 7 to 8 hours and it persists till decomposition. Okay. Now, sir, what about the rigor mortis? In 12 hours, mostly it appears in all muscles of the body, and in cold, it will appear little bit earlier. In next 12 hours, it remain in all muscles, and in next 12 hours, it disappears from all muscles of the body. So, as you can see, yes, if rigor mortis developed, that will be almost 12 hours or less than 12 hours because it is a cold. And liver mortis is over the back and fixed. So liver mortis is fixed in 7 to 8 hours. So without any doubt, the best answer will be 6 to 12 hours. Now, one option was 12 to 24, but it was not the right answer because rigor mortis develop in all the limbs within 12 hours. Because within 12 hours or in 12 hours, it develops all over the body. So best answer will be 6 to 12 hours. Okay, Sharad? हाँ, कॉर्निया डोनेशन का भी आ जाएगा, आइडियल टाइम अभी आ जाएगा. चलो देखो दोस्तों, सारे क्वेश्चन आपके ना, आपके सारे क्वेश्चन नोट्स में से ही हैं. पेशेंट केम टू द हॉस्पिटल, मसल वीकनेस, डायरिया, ब्रेडिकार्डिया. He was diagnosed for the organophosphate poisoning, for which atropine was given. Atropine is an antidote of organophosphate. After atropine administration, which of the following changes are not seen? Okay. Okay, a man of 60-year-old brought dead to the hospital during autopsy. हाँ, पहले इसको देख लेते बेटा, पहले इसको देख लेते फिर उस पे भी आ जाते हैं. So if the question is given about the brick red, that is indicating cyanide poisoning. Brick red is indicating cyanide poisoning. Chalo, let's see that one also. So organophosphate poisoning for which atropine was administered, and after atropine administration, which of the following changes are not seen? Now, as you can see, these are the muscarinic effect of the cholinergic. Okay, that is increasing secretion, bradycardia, and everything. And these are, my dear friend, these are the muscarinic effect, and these are the nicotinic. Nicotinic is muscle weakness and everything. Okay, what will remain after atropine? Okay, now as I discussed, atropine only arrests muscarinic but no effect on the nicotinic. Atropine only arrests muscarinic but no effect on the nicotinic. So as you can see, this is the nicotinic, that is a muscle weakness. So muscle weakness is not going to be affected here without any doubt. Muscle weakness is not going to be affected because bradycardia, diaphoresis, nasal discharge, increased secretion, lacrimation, everything is affected by muscarinic. So muscle weakness, which is a nicotinic effect, is not affected. Yes, Rahul bilkul sahi bol raha. What will remain after atropine? Muscle weakness is not going to be going because like it is affected by nicotinic receptor. So the answer here will be muscle weakness. What about the brick red question, anyone? The brick red question, a man of 60-year-old brought dead to the hospital during autopsy of heart and slice appears brick red. The brick red color of the staining that is seen in cyanide poisoning. Bright red or brick red. Okay. Chalo, ye bhi ho gaya. So we can see this was the slide given in the PrepLadder notes, and this is wonderfully explained. These are the muscarinic cholinergic effect, yes, and these are the nicotinic cholinergic effect. Achha, they asked about the death of old man. Achha, cyanide was not in the option. What were the option there? Anyone? What were the option there? Okay, chalo. I'll come to that question last. Okay, wait. Two friends were working together in the construction site. A hammer fell on one's hand and the other friend's head. The X-ray revealed the depression. So if this was a depression, I'll come to that question. Don't worry. The X-ray revealed the fracture. That which type of the fracture was there? It was a depressed fracture because the hammer is causing depressed fracture. As you can see, yes, this is the depressed fracture caused by hammer, and in the X-ray you can see the depression in the skull vault. This was a very simple question. During forensic examination, the skull bone was brought to the police where the cephalic index was 85. The skull belongs to, yes, it is Mongol. It is Mongol, a clear question I discussed. These are the cephalic index. Dolichocephalic, that is the value 70 to 75. Mesaticephalic, that is 75 to 80. Yes. And brachycephalic, that was Mongol. This question was asked, that is 80 to 84.9. So here, without any doubt, the answer is Mongol. अभी आ जाएंगे, confusing question पे आ जाएंगे. Okay, रुको बेटा, रुको. The phosphine gas causes which hypoxia? Actually, the phosphine is a very, very important metabolite of ALP3. That is, Dolly Mishtan Bandar or Doodh Mishtan Bandar. Just Chirag Joshi is telling that is Dolly Mishtan Bandar. Yes, you can remember by DUMB dumb, that is a Doodh Mishtan Bandar. So you can remember by trick dolichocephalic, mesaticephalic or brachycephalic. चलो आपको सारी ट्रिक याद तो है. That's very good. चलो. The phosphine is a very important metabolite of ALP3. ALP3 inhibits, actually this was also mentioned in my notes, okay? So you can see this is the one. The 3 gram of phosphine was there, yes, and it inhibits cytochrome oxidase. And inhibiting the cytochrome oxidase causes cytotoxic or histotoxic hypoxia. So here, without any doubt, the answer is histotoxic hypoxia. So this was given here, yes. The phosphine ALP inhibits, like this is cytochrome oxidase. Cytochrome oxidase is the complex electron transport chain complex number 4. That is causing histotoxic or cytotoxic hypoxia. Very simple. This was the corneal transplantation time. That was within 6 hours of the death, it has to be done. Within 6 hours of the death, it has to be done. Every question, most of the question, 99% question were directly from notes. But there was a twist and turn in these questions. Brick red timing, they asked the 0-6 hours, 6 to 12 hours or 12 hours. No, if it's a brick red, the poison is cyanide. But like that means the staining has developed. Postmortem staining has developed. Postmortem staining is developed or fixed, that means it is a 7 to 8 hours. Fixed postmortem staining, that means it's a 7 to 8 hours. सर आपने केस हो जाएगा पेपर लीक का. Okay, no issue. But again I am telling you, most of the question, 99% question of the forensic were directly from the notes. Yes, a female child was given there and the multiple burn injury involving entire front of the right arm, chest, abdomen and right thigh. So front of the right arm was given, front of the chest was given, front of the abdomen was given, and front of the right thigh was given. Okay, so you can see, as you can see, this is a rule of 9. This is a rule of 9, and this was given in my notes. Yes, wonderfully. These are the area. Head and neck, that is 9. The front part of the chest, 9. The upper limb, 9 and 9. The front part of the abdomen, that is 9. Lower limb, 9 and 9. And the another lower limb, 9 and 9. This was given beautifully. So, yes, all the questions were directly from the notes, but you can see the arm is 4%. Yes, arm is 4%. Front part of the chest, 9%. 4 plus 9, that is 13. Abdomen was also front of the abdomen if was given. That was 13 plus 9, 22. And you can see the thigh is around. The front part of the thigh is given. That will be 10% of entire thigh. And the front part of the thigh will be given. It will be 5% only. So this is given beautifully in this one. Okay. So the calculation comes around 20 to 30% without any doubt. And upper and lower abdomen and one over the that Vikash, but kuch bhi question diya hua ho, doesn't matter, but just see the concept. Head and neck 9%, right upper limb 9%, left upper limb 9%, chest anterior part 9, back 9, abdomen anterior part 9, back 9, arm, forearm 432%, head and neck completely was 7 and 2%. So just see this one. If you see this one, you will get this one. Chirag Joshi is saying 40 to 50% sir tha answer. Acha, front part of the right hand, chest, abdomen or front part of the right leg was given. Doesn't matter. Sir, no picture of the snake or plant poison. तो मैं तो इसमें क्या कर सकता हूँ बेटा? अगर आपके plant poison और snake picture नहीं आई तो, but अगर if this was the question, this is the right answer. Okay, and you can see, just get the screenshot of this one. This will get everything, है ना? चलो, this was a rule of 9 without any doubt. This is head and neck 9%, upper limb 9% each, trunk 30%, genitalia 1%, and this was lower limb 18% each. Yes, no problem. ये क्वेश्चन था क्या? Chronic alcoholic for last 7 years could not drink for the last 2 days, disoriented, delirium and sensation of spider running on the skin. Was a question? Anyone? Was a question like the last 7 years he was drinking, but like he left for last 2 days? Was a question? Yes. So without any doubt, disorientation, delirium and spider running, he is feeling it's a delirium tremens. It's a delirium tremens. Very good, sir. Very simple question. So, anyways, the only one question, actually, spider symptom was not given, but still, if spider symptom was not given, the person is disoriented or delirium, the answer will be delirium tremens. Magnan symptom is seen in cocaine poisoning, Wernicke's encephalopathy in alcohol because of vitamin B1 deficiency, and again, Korsakoff psychosis was the snake hallucination was given. Okay, no problem. Hallucination was given. That is also a delirium tremens because in delirium tremens, the visual hallucination is the most common hallucination. Okay, the signs of everything is seeing the dark brown scab of the wound. That's a 4 to 5 days. Don't worry. So, sir, what I'm telling you, according to me, the forensic medicine was not easy, not moderate. It was easy to moderate, but all the questions were directly from the notes. हाँ, little bit twist and turn was there. थोड़ा twist और turn था, लेकिन आपको टेंशन करने की जरूरत नहीं है. आपके लिए बेस्ट विशेष एग्जाम के लिए बेस्ट ऑफ लक और आप अच्छी तरीके से एग्जाम पास करो. हाँ, इट वाज मॉडरेट. He drink from 2 days. He couldn't drink for last 2 days. अच्छा, ये कह रहे हैं सर, but expected topics were not from there. Doesn't matter. If even scab is dark brown, it will be 4 to 5 days. And if the question is the bright or brick red, staining is there, and the question was asked the when it is fixed, again the answer will be 7 to 8 hours. That will be 6 to 12 hours. Okay. इसमें पीएसएम टफ था, कोई बात नहीं बेटा, पीएसएम टफ था तो उसका भी इलाज है, लेकिन आपके लिए ये पेपर फोरेंसिक का तो भाई, इफ देयर आर 17 to 18 क्वेश्चन, according to me, you should crack, like after reading Jhamad sir notes, you should crack at least 15 questions. हाँ, court summon I already discussed here. Civil criminal, both civil criminal higher, and if same level, you just attend the summon received first. Anyways, just go through these like question which are very important. The court procedure, there were 5 to 6 questions only from court procedure. Okay, so best wishes for your exam, best of luck for your exam result. Keep smiling. Good luck. Goodbye.